Hello and welcome to this session. Nice to be with everyone. We have an exciting session today on prioritizing NCDs in future pandemic preparedness and how we can address the concomitant risks of the virus and the underlying NCDs. First, let me say that I hope that you and your families are faring well amongst the many challenges that we're facing globally. My name is Dr. Amrit Ray. I'm Global President of Research, Development and Medical at Upjohn, a division of Pfizer, and I'm honored to moderate today's discussion. The importance of prioritizing NCDs has been growing over the last few decades as these silent killers have overtaken infectious diseases as the major cause of death and disease globally. NCDs are responsible for over 2/3 of all deaths worldwide each year. They cause significant morbidity and disability and disproportionately affect people in low and middle income countries, in which 4 out of 5 of the people live with an NCD. Now, despite NCDs being often preventable and largely treatable, more than 50% of countries lag behind the WHO's Sustainable Development Goal to reduce premature mortality from NCDs by 1/3 by 2030 through prevention and treatment. Now, as the global health community collectively mobilizes to combat COVID-19, the intersection of acute illnesses and chronic diseases presents a new challenge to public health. Vulnerable patients, including those with existing NCDs, face heightened risks, and physical distancing and quarantining have contributed to poor management of NCD risk factors, including unhealthy diet, physical activity, increased tobacco usage, and the harmful use of alcohol and limited access to very routine medical appointments. So from my perspective as a physician researcher and as a leader at a multinational company, I can speak firsthand to the new waters that we've had to navigate at Upjohn as we work to fulfill our commitment to those with NCDs, while simultaneously working to disseminate medically accurate information about the virus and working at an accelerated pace to bring a COVID-19 vaccine candidate to the market. It's in this context that our panelists will discuss 4 major challenges during the COVID-19 pandemic. First, we have what is already recognized as high morbidity and mortality among NCD patients globally. Okay. Second, we have an infodemic and conflicting messages sometimes from governments that can create fear among patients with NCDs, can result in them not self-referring or visiting their secondary prevention regular clinics. Third, we have health systems that were disrupted, along with the full range of preventative, curative, rehabilitative, and palliative treatments. Disruption of supply chains has also created access challenges. And lastly, I think we see patient support groups and organizations being impacted, and that has long-term effects. So in that context, I'm very honored to introduce my esteemed panelists who will explore these issues and discuss the necessary steps to mitigate the negative impact of this pandemic and future health emergencies on patients with NCDs. First, Dr. Mark Perrone, Vice President of the International Diabetes Federation, will discuss the impact of COVID-19 on diabetic populations, especially those that are insulin dependent. Next, Mr. James Hedden-Fitzer, Director of the Global Access Accelerated Program, will discuss potential solutions for making access a reality in difficult situations like this pandemic. And finally, Dr. J.S. Thakur will focus on the impact of COVID-19 on hospitals and medical institutions. Thank you all for being here, and I look forward to hearing your diverse perspectives. Dr. Perrone, let me hand over to you. Please introduce yourself, and the floor is yours.
Thank you very much, Dr. Ray. I think you you made my life easier sharing some data on NCDs and so how NCDs became a priority in public health and global health in general in the last decades, and also now as a challenge in terms of NCDs with COVID-19. So this dangerous association that was also discussed a little in the previous panel, and that I'll bring also some data in this presentation. And here I'm talking not only as a researcher and a member of the board of different organizations, but also as a person living with NCDs, with diabetes, and with other NCDs. So, and because of that, I will start by thanking the organizing committee of this conference for allowing me to share some perspectives with this very broad group of stakeholders that I hope truly bring to their countries and globally the messages to improve health and care for individuals with non-communicable diseases, and protect them from COVID-19 and other potential pandemics in the future with measures that we will discuss. But also I would like to acknowledge the healthcare professionals and healthcare workers that did not give up during this crisis, and that were obviously key to keep many people with NCDs and other health conditions safe during this moment of severe, sometimes chaos in health, in the health systems. I'm also going to discuss about mistakes and their outcomes in 2020, and I'll suggest ways to correct directions and prepare for 2021, and we'll close with lessons learned. So the first thing I would like to share is that what really astonished me was the fact that there was knowledge available that SARS virus, so from previous pandemic or epidemic, if you prefer, would be more severe in individuals with non-communicable diseases, and especially in the ones with diabetes, and even more when diabetes was associated with other comorbidities. So taking that into considerations and knowing the early data from China that people with diabetes and other NCDs, especially cardiovascular disease, but also cancer and respiratory diseases and other NCDs, were dying more than populations without comorbidities. It is interesting to think so that we need to identify the need for identifying high-risk populations and protect especially them. And my feeling is that we could do better in this case, in the COVID-19 pandemic. So here, a research we conducted in SACA region, so South and Central America region, in the beginning of the pandemic. So this was in between the end of April, beginning of May, and as we can see, even in the beginning in this region, so there is part of Latin America, many countries were already experiencing lack of medicines or supplies for diabetes care and difficulties in accessing health services, and also lack of fresh vegetables and fruits. So food insecurity, which was described by Life for a Child, for example, among other groups in Africa as well. So the individuals with diabetes and other NCDs were, since the beginning of the pandemic, experiencing difficulties in terms of the supply chains that were not working well anymore, the accessibility to health services and their medicines, and also to food, which are key elements of their treatments. So as we see here, specific measures, we want to know also if specific measures were implemented in those countries, and few of them had implemented specific measures, and very limited, obviously, specific measures. So as we see there, 16% with medicines and supplies delivered at home, and 21% providing enough medicines and supplies for 2 to 3 months in order to prevent individuals to go monthly to the pharmacies or to the healthcare facilities, obviously in order to facilitate the stay-at-home model to protect those individuals. But even in those countries, so about 1/3 only of the countries researched had any specific measures. But even among those, the measures were not fully implemented, were not working fully in some of them. So we also researched that in Brazil, there was, they had announced that we're going to distribute medicines and supplies for NCDs individuals enough for 3 months, that only 20%, repeating again the number, but coincidentally, it was the same number, only 20% of the individuals were receiving enough for 3 months. So even with specific measures adopted, they were not truly covering the entire countries many times. So here's another study we conducted. This in Brazil. So I started talking about the results, and also a couple months after our publication, another group in India conducted a very similar study with very similar results. So a decrease in physical activity in individuals with diabetes, increase in food intake, so difficulties in accessing healthcare, and as a result, increase in blood glucose. And as we know, that's why the star is there. As we know, individuals with higher blood glucose or higher variability of glycemia, they are in even greater risk, not only individuals with diabetes, but as different studies show, also the high blood glucose and variability in blood glucose bring those individuals to a much higher risk groups. So, which means that those individuals during the pandemic were migrating to a group of increased risk if infected by COVID-19. So, when I say increased risk, the risk for severe COVID-19 and death. And here we see another study, interesting study also in India, showing individuals with type 1 diabetes that experience an increase in blood glucose during the lockdown, and individuals more familiarized with diabetes know that 8.8% to 10% is very clinically significant, not only statistically significant in terms of increase of A1C, and this due to lack of insulin and glucose strips that obviously are vital for individuals with type 1 diabetes as a consequence of this break in supply chain and difficulties in access, obviously. So this is part of an article that we have just submitted, and that was not published yet, but where we show that protecting individuals with NCDs, diabetes, and other NCDs would be an important way to prevent also the impact on the health systems and the economy in general. So here we see all that's in Brazil in the end of August. Now it's more than that, more than 100,000 deaths. But let's say that we could protect perfectly all individuals with diabetes in Brazil. So then individuals with diabetes wouldn't die of COVID-19, what would happen would be that the number of deaths would be reduced in more than 31%. So more than 31% of the individuals who died in Brazil were people with diabetes. So that's why the importance of identifying the high-risk groups and protecting them. And this way also, we would be protecting the health systems and the economies. But how about if you could protect individuals with non-communicable diseases? Well, then we would be saving more than 62% of the individuals. And if we go to other countries, we would see similar or even more impactful results. I was very impressed in looking at a study in Italy that shown that individuals without any comorbidity, and when we say comorbidity, most of them are non-communicable diseases, only 3.9% of the individuals did not have any comorbidities. So which means that more than 95% of the individuals who died were individuals with NCDs, most of them with NCDs. So what are my suggestions then for correcting directions were to continue or initiate measures to protect high-risk populations, so elderly, diabetes, and other NCDs. Be careful with flexibilization, so individuals may misinterpret that now they can do certain things with all the careful measures that are preconized, but obviously, what are the limitations, especially for the high-risk groups? This should be clearly identified and announced. Identify also and fix accept access gaps for medicines, for access to medicines that those individuals need, as someone living with a chronic condition, and also access to healthcare professionals that could be through telemedicine or other strategies. But anyway, they need to know how to access. It is not only enough to have it available. And prepare the system for high post or even during COVID-19, because we don't know when it will be over. The high demand, because as we know, increased glycemia, for example, means more chronic complications. So we may see now an increase in prevalence of complications, and how will the world and the countries deal with that? Besides, decrease physical activity and increase weight means more non-communicable diseases. So we need to be prepared, but obviously it is the best would be to anticipate that and to use some preventive measures. And lessons learned that I want to share also: do not underestimate outbreaks, act rapidly. I think this is, we didn't do well in this. Potential return of viruses families with epidemic, pandemic potential. We also read many reports of scientists saying that after SARS and MERS, the research for medicines and vaccines were reduced because they were not active anymore. But obviously, we need to be careful to do not underestimate the return of viruses families. Quickly identify high-risk groups and implement specific measures, as I said before. Invest on a model of integrated universal health coverage with strong connected data system, primary and specialized healthcare, supply chain, and telemedicine to be able to attend the population, and especially those with chronic conditions during those phases that we may experience again pandemics, and we need to be prepared. But even if we don't experience pandemics, this is important to have a much better health system to truly improve care of individuals with non-communicable diseases, and respond together with partnerships with public, private, and not-for-profit sectors, as we saw in some countries that had relatively a better better outcomes in terms of fighting, responding to this pandemic, such as Portugal or Australia, and stop directing all funding. This is obviously something that I would ask all the global health community and all the governments to stop directing all funding away from NCDs care and research, because NCDs will need now the most the investments in order to rebuild and be prepared for those cases that I showed that may now be with more complications, more individuals with NCDs, and we don't know all the consequences also in terms of long terms, mid and long terms of this pandemic to individuals with NCDs. So please do not direct funding away from NCDs care and research now. And that's my presentation. I'll be happy to answer questions in the next part of the discussion. Thank you.
Thank you very much, Dr. Barone. I really appreciate your just thoughtful insights. We will come to Q&A at the end of the session, but I just want to reflect a little bit that there's so much that you brought across that I think is going to stimulate some good questions. I was particularly touched by, I think you brought a very human perspective and a very individual patient perspective by talking about even the impact of supply chain disruption on the availability of glucose strips, and you can imagine all the downstream consequences. I really also appreciate how you talked about sometimes the psychological, social, and epidemiological phenomena that we see of risk compensation when behaviors change as a result of having, for example, masks and taking greater risks. I think we see around us in society. And then the lessons learned that you offered, I think there are a lot of people listening who will be taking notes like me and can probably help us try and all benefit from this moment to do something positive for the future. Very powerful. Thank you, Dr. Barone, a real pleasure. Okay, so let us move on with our panel. Next, I'd like to come to Mr. James Fitzer. Handing over to you. The floor is yours. Please introduce yourself, and we look forward to your comments.
Excellent. Thank you so much to everyone. And I'd really like to thank the organizers for the opportunity to participate in this extremely important event, but then specifically in this session around prioritizing NCDs in future pandemic preparedness. I think this is a subject that's very near and dear to my heart, and it particularly highlights the importance of taking a health system strengthening approach. So today I'm really delighted to share with you a few practical perspectives from the private sector in our experiences in developing targeted interventions for reducing barriers to prevention, treatment, and care for NCDs, but then also how have we leveraged this previous investment to help mitigate the impacts of COVID, looking at building resilient health systems moving forward in response to the unexpected impacts from this pandemic. So I run the Global Access Accelerated Initiative, which is an operational public-private partnership led by the global biopharmaceutical industry. While we are the global biopharmaceutical industry, we see that this is an example for the broader private sector to add proactive value in the context of sustainable development to help move towards public health priorities in the context of health system strengthening. So with our initiative, we take a multi-sectoral approach where we work with different sectors, other private sector actors, civil society, the ministries of health, community organizations to really identify where are the needs, where are the gaps, and how can we tailor and target specific time-bound interventions to help fill some of these gaps. Very importantly for our work, we put the people living with NCDs at the center of everything we do to make sure that as we craft and design interventions that have resonance at the community level, that it's actually those people that will benefit from those interventions that have the opportunity to articulate their perspectives in the beginning so that they have ownership and they're already engaging with the development of the interventions that we're creating. So while our initiative has focused from the beginning on reducing barriers to prevention, treatment, and care for non-communicable diseases, the fact that we took this health system strengthening approach, I think, has been extremely valuable in the context of COVID. With the unexpected impacts of COVID, we've seen that it's the people living with NCDs that are at the highest risk for bearing the most burden of the impact from COVID. So we can't lose the fact that it's the people living with NCDs that need to be at the center of what we do to help mitigate the impacts of COVID. From what we've seen working with the ministries and the various partners, how can we take our interventions? We've worked with, for example, digital platforms in the contexts of NCDs. How can we help people living with NCDs have digital tools to more effectively interact with their health system? These same tools have resonance in the context of COVID because with COVID, individuals have been encouraged not to go in person to the clinics, but they need to find digital tools to be able to interact. How can we pull the different experts together to pivot the infrastructure that we've been building for digital tools in the context of NCDs, but make it resonate for mitigating impacts from COVID, but also being integrated into a broader health system strengthening perspective with resilient health systems. Another example that we've seen is around supply chain integrity, particularly with access to insulin and cold chain. We've heard from ministries, civil society, and partnerships that cold chain integrity is a challenge in low and middle income countries. We've been focused before COVID on how can we take steps to help make more robust this, the supply chain and also the cold chain. In the context of COVID, we've heard that potential treatments for COVID and vaccines are expected to be extremely heat unstable or temperature sensitive. What are the steps that we can take in preparation for deployment of COVID treatments and vaccines to link to the cold chain work that's already going on in the context of insulin and other temperature sensitive treatments to pull those pieces together in a coordinated, effective way? We as the private sector have a valuable contribution to make to be able to help operationalize some of these interventions, but it's working through partnerships and through the ministries and various international organizations that require setting out this structure so that the policymakers can have information and data to be able to make informed decision making, but then we can help identify the gaps in a proactive operational way to help fill some of these gaps. We see that the pharmaceutical industry has a lot more to add to this work than just commodities. We have a great deal of knowledge, of data, of incubating ideas, hackathons. How can we put this expertise to the best use, bringing in NCDs and pandemic preparedness with a sustainable vision moving forward? With that, I think I'll stop. I look forward to engaging in the discussion.
Great, thank you very much, Mr. Fitz. Extremely valuable comment and a great contrast to go right from the individual patient with Dr. Barone to the broader effects. I think you raised a few important points from a health system strengthening perspective and the role that, a lot of us are focused on frontline workers, but very much the role that policymakers and advocates can make, which is, I think, insightful. And then something that we are all thinking about and currently using, the importance of digital tools. And I hope we can come back to that as well. That offers some exciting potential. Thank you. Okay, I would like to just move on with our panel and I'll hand over to Dr. J.S. Thakur. Dr. Thakur, welcome. It's a pleasure to have you. The floor is yours. If you could introduce yourself, and we welcome your comments.
So thank you very much, Amit. And my name is Professor J.S. Thakur. I am representing here the World NCD Federation and happen to be the president of this organization. I work in a medical university in the northern part of India as a professor here. And this is one of the largest public health sector hospital in India. Now, in my presentation, I would like to talk briefly about the World NCD Federation. the comorbidity and the COVID-19, the global, national, and the local perspective, and key initiatives of this organization. So World NCD Federation is a professional association working in the area of non-communicable diseases, and it was launched in 2015 in Chandigarh, and its focus is prevention, control, and management of non-communicable diseases globally and achieving sustainable development goals. Our focus is mainly strengthening primary and secondary healthcare system because we have individual professional association working at the tertiary care level. So it officially came into existence on 7th March 2015, which is celebrated also as its foundation days. So World NCD Federation has regional branches. So as of now, we have branches in Southeast Asia, and presently it is in Nepal. And then we have branch in South Africa, in the Africa region, that is Zimbabwe. We have now the Western Pacific branch in China, and we have also this branch in Latin America, that is right now in Argentina, and also we represent the Caribbean islands. Then we have, the European branch, which is led by the former CEO of the Defeat and City Partnership. We work at a very high level of policy making, and in fact, our regional coordinator for Latin America region is the former health minister of Argentina. So this is the level on which we work. About the activities of World NCD Federation, we have short, integrated, and disease-specific courses. We also run international NCD course. It is now the 6th edition, which is there. It is done on an annual basis. But we have a lot of demand from all over the world, and we will be rotating this course. We have national and international working groups, and also patient groups in different NCDs. We also work in building research capacity in NCD, and the organization has started a Center for Evidence-Based Research, where we are commissioning few systematic reviews and meta-analysis to bring the evidence for evidence-based medicine. We organize World NCD Congress every year, and the second World NCD Congress is scheduled in University of Michigan in US. It was unfortunately, was to be organized in August this year, but it has been shifted to next year because of this pandemic which is going on. And 7th March, basically we celebrate as World NCD Day to focus on prevention and advocacy issues related to NCDs. Among our official publication, we have a book on public health approaches to non-communicable diseases, which was released by the Union Health Minister of India in June 15. We also publish International Journal of Non-Communicable Diseases, which is a quarterly journal of and is the official publication of the World NCD Federation. And we have also manual for health workers pertaining to prevention and control of NCD, which are available beside English in Hindi and Punjabi, and they are available from the respective publishers. Coming specifically to the topic, if we see COVID-19 and non-communicable diseases, and this table shows the risk of hospitalization. And this is the data from the CDC, that you can see that risk with or hospitalization along with comorbidity of COVID and NCD is very high among various NCDs, which varies from 1.5 times in hypertension, 3 times with obesity more than 30, 3 times diabetes, 3 times we have already heard our colleague, chronic kidney disease 4 times, severe OST 4.5 times, two conditions 4.5 times. And this comorbidity due to COVID-19 and NCD is a big problem in the country in which I am right now, that is in India, as well as in all low middle income countries and other countries also. So if you see the underlying comorbidity and COVID-19 globally, hypertension is very common, cardiovascular diseases, diabetes are very common, and coexisting HIV and malignancy. These are also some of the conditions. And if we take a case study of India, you will find that 60% of COVID-19 infected patients had comorbid condition, including diabetes, chronic kidney diseases, hypertension, or heart disease. Recently, we are doing the data analysis for Punjab, which is one of the progressive state in India. And this table is showing the underlying comorbidities and COVID-19 deaths in Punjab. And surprisingly, in this state, 90% of the COVID-19 deaths in the state have one or two comorbid conditions due to NCDs. And commonly, almost 52% of the deaths are in diabetes, 45% in hypertensive patients, 21% in heart diseases, and 20% in other diseases. And these kidney diseases are also very badly affected. And this co-infection of chronic kidney disease and COVID-19 is very common. And access to the dialysis services for such type of patient is available only in few selected hospitals. So there is also, big problem of admissions for such type of patient. Now coming to the impact of this pandemic on hospitals and medical institutions, I would say that these hospitals and medical institutions are badly affected in LMIC, including India. Now, my hospital is one of the biggest public sector institution and considered to be among the top first and second hospital in the country. And our OPD services are closed because we have such a big, rush of COVID-19 patients. And secondly, we also get non-COVID emergencies in the institution where 50% are turning out to be COVID positive. So this is not only a challenge for having the access to the treatment, but there is a threat of infection to the healthcare workforce also. Because if you are getting non-COVID emergencies and turning out to be positive, it is a big problem. Another important thing.
Dr. Thakur, just we've got 3 minutes to wrap up. Thank you.
So non-COVID death rates are also increasing. Many people are dying because they do not have, access to the admissions and the treatment. Medical education is also badly affected because of the poor infrastructure, hindrance for online classes. Most of the students are tuned to online classes. Medical education is a skill and practical oriented. So this practice is very much affected because all these classes and, patient care is, they do not have access to the live patient care. Now, what need to be done with the people with the existing NCDs? I would say that, there are two important things which need to be. Healthy lifestyle, of course, is most important. And secondly, continue to take your medications and follow up medical advice. Because we have done statewide NCD surveys in state of Punjab and Haryana. Only, for example, 10% of the diabetic and hypertensive patients are controlled out of the total patients. So you can see the situation. So, and at least access to the essential medicine is also a big issue to many of the countries. Now, some of the key initiatives which World NCD Federation has taken, we have come up with the special issue of the IJNCD on COVID-19 and NCD.
Dr. Thakur, you're coming up to the end, so could you please
wrap up? Yeah, I'm closing now. So this is 11 articles which has been published, and this is especially focusing on this. We have recently come up with the World NCD Federation guidelines for prevention, surveillance, and management of NCD in low and middle income countries, especially in the primary and secondary healthcare setting. So this is our website and this is the email ID. If you have more information, you can visit our website. So with this, thank you very much for this opportunity, and thanks to the organizers for giving this opportunity.
Thank you very much, Dr. Thakur. Very valuable to hear your comments, both on continuing research and the investment in evidence-based medicine. As you reach your 5th anniversary, I think as an organization, it sounds like you've had a lot of impact. And I think that's a very positive start given the challenges. I'd just like to pause for a moment and check with our organizers whether we should continue with our Q&A session or...
Sorry, Dr. Amit Gray.
No problem.
We have run out of time, and the next session is waiting the genetic therapist.
Quite all right.
But you have summarized very well at each session. So the presentations will be left online as well. We'll continue this dialogue with all the presenters.
Wonderful. Well, let me...
Thank you very much for your time.
Thank you, everyone. Let me just say thank you to all of our speakers, very insightful comments. And I would like to end and say I'm very grateful to the IAPO for its work and the impact of organizing this Congress under difficult circumstances. Thank you to all of our panelists. And as we say at Pfizer Upjohn, I hope everyone can be smart, be safe, and be well. Thank you, everyone.
Thank you very much to everyone for this great opportunity.
Thank you. Thank you very much.